So thyroid nodules are lumps that develop within the structure of the thyroid gland. The main cause is unknown, but there are several different factors that might contribute to development of these lumps. Thyroid nodules are more common in women than in men, and increase in frequency of age as well. Women often develop thyroid nodules during pregnancy, but some of these might resolve after giving birth. Now, thyroid nodules develop in iodine deficient areas, and other factors that might contribute to their development is a family history of thyroid nodules, or if you've been exposed to ionizing irradiation in the past. Smoking and obesity are also other factors. In most cases, thyroid nodules are what we call asymptomatic or harmless, and they don't cause any symptoms. But a few of them may cause symptoms and grow in size and multiply, leading to pressure on important structures in the neck, most important of which is the windpipe that could cause difficulty in breathing, or if it presses against the esophagus, could make it difficult to swallow. Now, it might not do that, but just being in the neck may cause the sense of discomfort. A lot of these thyroid nodules are incidentally discovered, and they're really sitting there doing nothing and quite harmless. So most thyroid nodules, as I said, are not cancerous, and they wouldn't really be a cause for concern. But as I said, if they start growing and causing symptoms and pressing against important structures in the neck, then yes, they need to be addressed. It's important to note that they're very, very common. So the prevalence of thyroid nodules is about 5 to 10% of a randomly selected population. And the incidence is increasing every year because they're being picked up more incidentally on other scans like high-resolution ultrasonography, MRI scans, nuclear medicine scans, which pick up a thyroid nodule. And once we know about it, we try to understand exactly why it's developed and why it's sitting there. And most of them will be benign and will not require any further management. So if you develop a thyroid nodule, or if you're told that you have a thyroid nodule, the recommendation is really to go and see your doctor, who will make a decision on if this needs to be treated or not. Now, in order for us to make these decisions, we need to perform some investigations after asking you a few questions about the family history, about how it's bothering you, how it was picked up. But most importantly, you will need some blood tests, including a thyroid profile, to check if this is functioning, meaning if it's producing an excess of thyroid hormones or not. And the ultrasound scan will give us information about the structure of this thyroid nodule and how it's behaving by looking at the images. In most cases, as I said, it's not cancerous, and they can be either we can reassure the patients and let them know that everything's all right. Some of them will require follow-up in clinic, and those who have some abnormal cells on the needle biopsy, which we sometimes perform when we go ahead with an ultrasound scan, or look cancerous or are causing problems because of the pressure symptoms, then we recommend surgery. It's the ideal treatment. Now, in some occasions, if they're large and benign, we explore other options, non-surgical options in clinic as well. So surgery is necessary, as I said, when they are cancerous. They're definitely cancerous, and that's it's a small percentage of patients. So if we look at patients presenting with thyroid nodules, 90% of them will be benign, and only between 7 and 15% will be cancerous. And it's a cancer that's also very curable and easy to treat. Sometimes we don't know if it's cancerous or not, and we need to perform surgery to make this diagnosis and look at the tissue under the microscope. And if they're large and causing pressure symptoms with a large, what we call goiter, and it is an indication for surgery. In some cases, when you have an overactive thyroid gland that's producing an excess of thyroid hormones, and that's previously been treated medically, but some of these patients, they fail medical treatment and need definitive answer. One of those answers is surgery.